This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Doxy L Dr Forte Capsule is an effective medication for managing intra-abdominal bacterial infections and antibiotic-associated diarrhea in adults. It combines the benefits of an antibiotic and a probiotic. Indications and uses. This medication is indicated for the management of intra-abdominal bacterial infections and antibiotic-associated diarrhea in adults. It helps combat harmful bacteria while simultaneously restoring beneficial gut flora, providing a balanced approach to gastrointestinal health. How it works. It works by accumulating doxycycline within bacteria, inhibiting their protein synthesis, while lactic acid bacillus restores natural microbial balance in the digestive tract. Directions for use. Take this medication exactly as prescribed by your physician. Swallow the capsule whole with a full glass of water. Do not crush or chew it. Your doctor will determine the appropriate dosage and duration based on your specific health status, age, and weight. Possible side effects. Common side effects include loss of appetite, nausea, vomiting, and diarrhea. More serious side effects may occur, so it's essential to monitor your health and consult a doctor if symptoms worsen. Precautions and warnings. Consult a healthcare professional before use if you are pregnant, breastfeeding, or have pre-existing health conditions. This medication is not suitable for children under 8 years old. Be cautious of potential drug interactions and inform your doctor about all medications you are currently taking. FAQs. 1. Can this medication be given to children? No, it is not recommended for children under 8 years due to the risk of tooth discoloration. 2. What if I forget a dose? Take it as soon as you remember, but skip it if it's close to the next dose time. 3. Can I stop taking it if I feel better? Continue as prescribed unless otherwise directed by your doctor. 4. How should it be taken? Swallow the capsule whole with water, do not crush or chew. 5. Can it cause vomiting? Yes, vomiting is a common side effect. Stay hydrated and consult your doctor if it persists. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is appreciated.